So it is that time. I am going to, in very shortly, be using the enema. So the enema is designed for acute short-term relief of constipation. It's not meant to be used long-term as it can cause dependency and decrease bowel function. So with the enema, it comes in a bottle that looks like this. There's 130 milliliters inside. There's a cap on the top, and under the cap is the tip, which is actually pre-lubricated and latex free. So with this, you'll insert it rectally and then you'll squeeze the contents out. It's actually designed so there is 130 milliliters in here, but after you squeeze, only 120 milliliters or so will go in. So there will be some product that is left in the bottle after you have used it. And then, so on the box here, it does recommend positions for you to use. You can see here. So there's these 3 positions. They do recommend that if it's self-administration, that this position would be the best. So that will be the position that I will try to insert the enema. And they say also, because there might be leakage, that you should probably put like a towel or something under you. I will probably be doing it in the bathroom so that I'll be ready for when it does happen. Because it does take only a short amount of time, so 2 to 15 minutes. It should be relatively quick. And then what this does is it increases the amount of fluid in the intestines. So because of the increased amount of fluid, it will stimulate a bowel movement. And so it is really fast acting. It should work hopefully within a few minutes, and hopefully I don't experience too much cramping or gas, bloating, stuff like that, which can be side effects. They do say that with any case of constipation, to not use any medications if you are experiencing abdominal pain, nausea, vomiting, or severe dehydration, as this can worsen the problem. And if you are experiencing symptoms like that, you should seek recommendations from a doctor. So I will go and do this now. It is 3:41 p.m. and I will keep you guys updated very shortly. See you guys soon. Hey guys, so I'm back. So I did use the washroom and I also took a shower. So the time now is 4:38 p.m. So it did take overall everything about an hour. So I guess my experience with using the enema. So first of all, I had done this position. So I was on my back with my legs up, and when you insert the enema, it's recommended, it says on the box, that you should point it towards the navel, which is your belly button. But because it's fluid and you're trying to get it to go into the intestine, you theoretically would need gravity to help you, right? So your instinct is to tilt the bottle up, so then gravity would help the liquid move inside. But if I were to point it towards the navel, so my belly button, I would be tilting it downwards. And I feel like that whole process doesn't really help with administering the enema, especially if you're doing it yourself. I feel like it might be a product that's easier to use if you have, say, a nurse to give it to you, or a caregiver that can help with the administration. So overall, so lax enema, once again, is a sodium phosphate enema. It states that it takes about 2 to 15 minutes to work. So like I had said before, it's a 130 milliliter bottle. And then once you squeeze the contents in, there should be approximately 10 milliliters left or so. I felt that after I had squeezed the contents of the bottle, to the point where I couldn't squeeze it anymore, there was slightly more than 10 milliliters. It was more like 20, 25 milliliters. And so I don't know if that was just user error on my end, or if it was the whole just self-administering it was very difficult. So the tip of it, like I said before, is lubricated. But I felt that the tip itself, upon like insertion, was actually very uncomfortable. It almost kind of hurt. So I don't know if it was just because of the angle, maybe it's because I was just trying to like get it properly inserted. So there was that. And then, so after I had squeezed the contents of the bottle, there was still like 25 milliliters left. It says on the box to wait until you have a very urgent need to defecate. So you stay in the position until you have the urge, which took, I think for me, it was very, very quick. It took only about two minutes at most. If anything, it was less than that. And then, so then when I had the bowel movement, a lot of it was fluid first, because you are, putting in a lot of fluid into your bowels. So a lot of it was just fluid coming out first. And then I felt that this really, like, it would help to relieve the acute constipation issue, but I feel like it works very distally. So it works very, like, towards the end of your colon. Not so much like if you were looking to do a whole bowel cleanse. I feel like this wouldn't really be the product to do so. I feel like orally ingested products, like powders that you would mix and drink, would help with more of like the cleanse from beginning to end, versus this is more kind of just works, in my opinion, at the end of your colon. But it did definitely help to stimulate like the contractions that you need for the bowel movement. And then, afterwards, I didn't get too much cramping. There was a little bit of cramping in there, but it didn't last for very long. It actually lasted a lot shorter than when I had used the Senecot. And overall, I feel like it does do its job. It does affect the colon in a way where it helps to relieve acute constipation. But once again, if it was like a whole bowel cleanse that you're looking for, I don't think that this would be the product to do so. Overall, I feel like the convenience, it wasn't very convenient. I feel like it was uncomfortable to use. I'd spent a lot of time on my back just laughing because me trying to squeeze the bottle and stay flat on my back was very uncomfortable and awkward. So I feel like maybe if you had a caregiver or a nurse that was giving it to you, it would be a lot easier. And I don't think that I would choose to use this product again if it were to just be for acute constipation. I feel like using oral products like Senecot tablets, or even Dulcolax tablets, Docusate, those would definitely be a lot more convenient to use.